What if you could predict who's most at risk for a sexually transmitted infection before they ever get sick? It sounds like science fiction, but a brand new study is exploring exactly that, using AI to build what's essentially an early warning system for global health. Let's get into it.
So to really get why this is such a big deal, you have to start with this number, 376 million. That's the estimated number of new, curable STI cases that pop up across the globe every single year. It is a massive, almost unbelievable figure.
And, behind that giant number are some very real, very human reasons why it's so hard to get this crisis under control. So what's really going on here? What's standing in the way?
Well, it really boils down to this. A lot of people just don't get tested, and it's for a few key reasons. Sometimes people honestly just don't know they're at risk. Other times, testing services are hard to get to, or maybe they're not available at all. And then there's the big one, stigma. People worry about being judged, so they might put off getting help. And all of these barriers, they don't just affect one person, they create these huge gaps in our public health defenses, which makes stopping the spread incredibly difficult.
But what if technology could help us tear down some of those barriers? This is where we get to the really cool part, a new generation of smart tools designed to tackle this problem in a completely new way.
So, let me introduce you to MyStarRisk. It's an AI tool that uses machine learning to look at a whole bunch of data and then calculate a person's individual risk score for 4 of the big ones: HIV, syphilis, gonorrhea, and chlamydia.
So how'd they do it? Well, the researchers got their hands on a massive anonymous dataset. We're talking over a decade of information from Australia's largest sexual health clinic. They fed all of that info into the MyStarRisk model, which then spit out a risk score for each person. But here's the catch. A risk score doesn't mean anything if you don't know where to draw the line. So their main goal was to find that perfect cutoff score to neatly separate people into either a high risk or an average risk group.
And that brings us to the real heart of the challenge here. I mean, a prediction tool is totally useless if it can't draw a clear, meaningful line in the sand. So you have to ask, how do you actually find that perfect cutoff? Where exactly do you draw the line between, hey, you should be concerned, and you're probably okay?
Well, it's a really delicate balancing act. The best way to think about it is like the spam filter on your email. If you set the filter too high, you end up missing a bunch of high-risk people. That's what scientists call low sensitivity. But if you set it too low, you flood the healthcare system with people who don't need tests, which is low specificity. Either way, you're either missing the problem or creating a whole new one.
So to find that perfect Goldilocks zone, the researchers used this really clever statistical tool called Uden's Index. Its whole job, its entire purpose, is to find the sweet spot, that one single point that perfectly balances your ability to catch the people who are actually sick and correctly identify the people who aren't. It's basically the mathematical answer to that tricky trade-off problem.
Okay, so they had their method. They knew how they were going to find the cutoff. Now for the exciting part. It was time to actually put this AI to the test and see what it could do. And the results were, well, they were pretty dramatic. Particularly for HIV, the model was amazing at pinpointing this relatively small group of people who accounted for almost all of the infections.
Let's actually look at the numbers. Using that cutoff point they found, the AI sorted everyone into 2 buckets. It put about 35% of the people into the high-risk group for HIV. The other 65% were classified as average risk.
And this right here, this is why this is such a potential game changer. That small, 35% high-risk group, they accounted for a staggering 86% of all the actual HIV cases found in the data. Let that sink in for a second. The AI was able to identify this small slice of the population where almost all the infections were happening. To put it another way, if the AI puts you in that high-risk group, your odds of testing positive for HIV are more than 11 times higher than everyone else. And this wasn't just a one-hit wonder for HIV. The tool was incredibly effective across the board. For syphilis, the high-risk group had over 12 times higher odds of testing positive. The AI was definitely onto something big.
This table just lays it all out so clearly. Just look at the difference in the positivity rates. For every single infection, the rate is just worlds higher in the group the AI flagged as high risk. I mean, look at gonorrhea. It's almost 15% in the high-risk group versus less than 2% in the average risk group. The difference is just night and day.
The study also turned up a really interesting, kind of surprising finding about PrEP. That's the preventative medicine for HIV. So just as you'd expect, people on PrEP had a much lower risk of getting HIV, but, and this is the key part, they actually had a higher risk for other STIs like syphilis and gonorrhea.
Now, that doesn't mean PrEP isn't working. It just highlights that the same behaviors can put you at risk for many different things, which is why comprehensive screening is so important for everybody.
So, what's the big takeaway here? What does all this mean for us in the real world? This is where we go from just being cool research to something that could actually save lives and make us all healthier.
Well, the potential impact is just huge. Imagine health systems being able to do targeted screening, focusing their money, their time, and their staff on that small group of people at the highest risk. It means prevention can be way more efficient. It helps policymakers write smarter rules, and in the long run, it could save a ton of money by catching things early before they become more serious problems.
Now, of course, we need to add one little piece of context here. This study was done using data from a specialized sexual health clinic, a group of people who are already at a higher risk than the general population. So this tool is really good at finding the highest risk people within an already high-risk group. It's not necessarily designed to predict risk for just anyone walking down the street.
But this research really opens the door to a huge question. If AI can get this good at predicting risk for STIs, what's next? Could this kind of technology completely change the way we think about all preventative healthcare, from heart disease to diabetes to cancer? It's a pretty powerful idea to think about.